Well, kind of is appropriate as we go into our AM Minnesota program today. I don't know about toughness, but Dr. Eric Stroemer is with us. He is with the Summit Orthopedics, and I saw, first of all, welcome to the show, Doc. Thanks for coming on.
Thanks for having me.
Personally, appreciate your coming by this morning. I know you've got a very busy schedule, but you guys are moving here, I see.
Yeah. So the building we currently are in. This one? Okay. Sorry.
That's okay.
The building we are currently in, we've been in for 8 years now, and District 1 had previously owned it, and when Alina bought District 1, Alina now owns the building, and our lease wasn't renewed, so we are moving to a different place. So it's going to be here in Faribault. We didn't have enough time to build a new clinic, and but we found a space here locally out on Highway 21 where Dr. O'Halloran, the ear, nose, and throat doctor, has a clinic. I have the address here, but so it's exciting. It's change. It's different, but
you have enough space there?
Yeah, it's enough space for the doctors and our orthopedic services, but not enough space for therapy. Therapy is going to still stay at our current building. Physical therapy is. So it's 1645 Lindale, so it's kind of in between that Matt's Garage and the Faribault Garden Center. There's a building that says CH Bus Sales on the building right there.
Okay. Yeah.
Yeah, right there.
Well, that'd be a nice, convenient location.
Yeah, right off the highway.
Just off the freeway.
No, so that's starting July 10th. The first week of July, we're gonna move everything over there, and
that'll be fun.
Yeah, right. Well, I'm hoping that we hire that out. I don't know if they wanted me to be carrying boxes around, but we'll see. So no, that'll be good. So that's good. We're gonna stay here in Faribault and see as many people as we can.
Yep. You have. I see you also work at the Lakeville Clinic, right?
Correct. So we have still in the last 10 years had clinics in Faribault, Northfield, Farmington, and Lakeville. And those are all still staying the same. Now that we've merged with Summit, we're obviously part of a bigger group that has clinics in Apple Valley, Eagan, and all over the East Metro.
Sure.
So
they haven't expanded to the West Metro.
You know, some of it they have. They have a very robust spine service line that has got state-of-the-art non-operative spine stuff. So most spine problems don't need surgery, and so Summit and what's called Institute for Low Back and Neck Care merged last year, and they have a really excellent program for non-operative spine care to try to get you feeling better without having to have surgery.
So if you have a patient that has this problem, you can refer them up to the...
Yeah, so we definitely have better access now to lots of different specialists, that things we don't really do. So
right.
Spine stuff, a lot of complicated hand surgery stuff, complicated foot and ankle stuff. That's really helped. You know, we have access to more specialists now.
So you'll do the basic, but you're talking when you have multiple...
Yeah, if someone has... You know, someone had power sawed their hand and cut a bunch of tendons, we'll usually send that to a hand specialist.
Sure.
Or if they need their entire foot reconstructed, you know, we'll send that to a foot and ankle person. And now we're part of a group that has all that. We've only been part of the group now for 4.5 months.
Right.
And so we've already been talking with them about possibly sending a spine specialist, a hand specialist, foot and ankle specialist down once a week to Faribault to see patients, so you know maybe you don't even have to drive very far.
Oh, that'd be cool.
Yeah, that will be nice. But again, it's still brand new, and we're just trying to work on figuring it all out.
But it hasn't changed much for you, I would assume. You're still just serving your patients.
Correct. Yeah, I try to. You know, unfortunately, in this day and age, you gotta do a lot more computer stuff and think about some business stuff. But I try to it's just me and the patient, close the door and figure out what's wrong and let somebody else deal with the other stuff.
Yeah, I can tell you've got a passion for the nitty-gritty work of the whole
Yeah,
thing.
No, I like that part of it.
We're going to talk about, I saw on your website that you're a specialist in carpal tunnel, We're going to talk a little bit about that.
Sure.
And maybe a couple of other things as well. When AM Minnesota continues, folks, with Dr. Eric Stroemer from Summit Orthopedics. We appreciate his stopping by. Of course, we'll talk about arthritis, hip care, you name it, here on AM Minnesota.
Whether it's in the shop or in the field, Harvey, Scott, and Seth are ready and able to get the job done. Backed up by some of the latest fabrication equipment, there are very few parts that can't be fabricated and installed on your equipment. Give a call to Metal Services at 507-583-2144.
Or stop in and see them. The repair shop is located 2 blocks east of the Dairy Queen. That's Metal Services in Blooming Prairie at 507-583-2144.
Summit Orthopedics here in Faribault. Guest Dr. Eric Stroemer. They've been around since mid-January. You announced that, right? The merger?
Correct. We merged January 1 of this year.
And that's gone very well. You were just
it's going great. Going great. Happy with the way everything's going, and again, I think it's going to improve our orthopedic service care around this area for sure.
Well, you already mentioned the fact that you can get more specialists involved in this.
Yeah, correct. So, unfortunately, some people that get real specialized in certain area of medicine kind of congregate in the middle of a metro area somewhere just so they can kind of be in the middle of everything. So, sometimes we'll have to send someone to Minneapolis or whatnot. So if we can get someone to come to us for appointments, I think that helps out the patient quite a bit.
You do your surgeries here locally?
Yeah, so we do all of our surgeries now at, a couple of different places, at the Northfield Hospital. And now that we are part of Summit, we now can do our surgeries at at this new state-of-the-art facility in Eagan that you can even do large surgeries such as knee replacement, hip replacement, shoulder replacement. It's not a hospital. They have a whole separate area called a care suite. It's like a hotel room. There's a nurse there the whole time. And you get to go home the next day. And the reason this is exciting is that it's half the cost of if you had your surgery at a hospital.
Wow.
So, in the old days, people didn't really even care because insurance covered it all and you never saw a bill or anything. But nowadays, everyone has high deductibles, high out-of-pocket maxes, etc. It's half the cost of having the surgery in the hospital. And then the infection rate is extremely low, so very much lower than a hospital, which also, unfortunately, hospitals, sick people are roaming around in hospitals, whereas surgery centers usually want to, just healthy people having surgery there. So, in what we do in orthopedics, we like to keep people as healthy as possible and stay away from anything with bacteria. That's a dirty word in our field. So. That's another exciting thing is now we have access to this state-of-the-art place in Eagan, and I even just last month did a knee replacement on a woman from Faribault here. She stayed overnight, went home the next day, said she loved it. Got to order food from a local restaurant that was delivered and everything. So that's exciting too, because I think things are changing. More surgeries are going to be outpatient and not be in a hospital. So I think we're changing with the times, merging with this group, and able to get up to some state-of-the-art stuff.
Well, correct me if I'm wrong, but I've had some friends had knee replacements and stuff, and you get them moving right away.
Yeah, we now get you moving, standing on it the same day now, walking on it the same day. We don't like people laying around. Bad things happen, and turns out it's better for your whole body to be moving and your knee. So we definitely want that within reason. We don't want to be falling and injuring themselves or their surgical area either. So there's a fine line there. But yeah, no, we get you up moving.
I have a sister that's suffered from carpal tunnel.
Yeah.
What is carpal tunnel?
So carpal tunnel is the name of a tunnel in the palm of your hand where a nerve that goes to all your fingers except your pinky runs in this tunnel. In that tunnel is also all the tendons that make your fingers move. Those are the ropes that pull your fingers. And carpal tunnel is a condition where that tunnel becomes tight. That can be from arthritis in your hand, that can be from inflammation of the tendons, that can be from inflammation of the nerve, lots of different reasons. Well, that nerve gets pushed on and your hand starts going numb. just like if you sat on your foot too long and it would fall asleep.
Right.
Okay. So that's what people come in and complain of a pain, a numbness, an achiness in their hand, the thumb side of their hand. There's lots of things we can try before a carpal tunnel surgery. There's a brace to wear when you sleep. There's some therapy treatments. There's injections, things like that, to see if we can get the inflammation down in that area, see if we can get the carpal tunnel to go away. If that doesn't work, then there is some procedures to relieve the pressure on the carpal tunnel. And people's hands, the statistics say it's 99% effective of releasing your carpal tunnel pressure and getting rid of your symptoms.
She wears a brace virtually all the time.
Yeah. So if you're wearing a brace and you're trying some therapy and you've even tried an injection and it's still there, then it's a no-brainer for me. It's a low-risk, high-reward type of procedure where you really can see a lot of benefit, because carpal tunnel surgery is a small little incision that really is low risk. There's no risk for bleeding. The risk for infection is super low. So
what do you do then?
So there's two different ways to do it. The traditional way, where you make a small 1-inch incision directly over the tunnel, and you go through the skin and the subcutaneous layer, and you get to the carpal tunnel, and you literally are releasing the roof of the tunnel. The tunnel's floor and the tunnel's walls are bones, so to move bones takes some serious power tools. So the roof of the tunnel, luckily, is tissue.
Little mini power tools? Is that
well, we have those, yeah, but we don't need those for this. We're just releasing the roof of the tunnel. It's a tough band of tissue, so you just use a scalpel, and it releases the roof, and the roof opens up and releases the pressure on the nerve. We kind of clean everything off, and then we leave the roof open, and your body will come in and heal that, make a bigger roof essentially. So then you have a bigger carpal tunnel.
Oh.
So then the pressure goes off.
What causes it though?
No one's really sure. Everyone used to think it's from repetitive typing,
right,
things like that. But I've seen, Joe the plumber and Steve the real estate guy both get carpal tunnel, neither of them type. So it's what they call multifactorial, meaning we're not sure why. There's probably lots of reasons that people get it.
Now, you mentioned arthritis earlier.
Mm-hmm.
Is that always involved in it or not?
No, it doesn't have to. I mean, a lot of times it could be your tendons are all a little thicker now because you were a bricklayer your whole life or something. You don't even have to have arthritis. So no, it's, again, multiple different reasons. The solution is still the same for all those reasons though, which is nice.
And you found this surgery is 99%,
yeah,
you said, effective?
It's one of my favorite things to do, because
it's so successful.
And it just doesn't hurt that much. It's something that you just can do without putting you all the way to sleep. You can get, within a week, you're feeling really good, kind of a thing. Whereas,
you mean you're grinding on my bones? And you don't
no, we don't do anything to the bones. We just release the roof of the tunnel. We're not grinding on any bones. It's just a soft tissue procedure.
Oh.
I was kind of making a joke. We don't move the bones when we do carpal tunnel. But let's say a knee replacement, which is a highly successful operation for knee arthritis, that hurts like mad for a couple months, and you're doing therapy and you're cursing out your surgeon because you wonder why you did this, and I love doing that too. But carpal tunnel is, doesn't hurt that bad. We see people a week later take a couple stitches out. They're like, my hand has already woken up, doc. Things like that. And so, you like to see people get better. And if you can cause less pain to get them through it, it's kind of a nice thing too. So.
Yeah, and that's what you like about the job. I can tell you like helping people.
Yeah, I mean it's fun to get to know people. I think I mentioned this before on the radio, and what we do, if I'm not taking out your gallbladder, you take out people's gallbladders all the time.
Heart transplant, or
what we do, we're the arm and leg doctors. We're trying to get you back to functional. So I like to know what you do for a living, what you do for your hobbies, all this kind of stuff, which you might not think has anything to do with your health care. But if you're someone who really likes to fish, well, then I really need to know, solutions might work good for that kind of motion. If you're someone who really likes to bowl, things like that. So I like to get to know people. It's kind of fun. I grew up in St. Paul, so it's fun around here to learn. I ask these farmers all these things about farming that I never knew. All sorts of. I get to meet so many neat people. It's just fun to hear about that stuff.
Do you see a lot of farmers in your practice?
Yeah. Oh yeah. Lots of farmers from around this area, and so yeah, they teach me little tidbits on farming and planting season, and they can't have surgery this time because it's harvest season, things like that. So I'm starting to, after 11 years here in this town, I'm starting to remember all that stuff.
You're learning when the windows are that you can do the surgery.
Yeah. Definitely farmers, usually it's in the winter time when things are slower. That's usually when they want to have their stuff done. But then we got the whole group of hunters that can't have it in the fall because they want their hunting in. And just did a hip replacement on Monday and saw him this morning in the hospital, and he was wondering when he can get out fishing. So we got fishermen, So I like to try to make sure it's the right time for all the things you want.
Well, being active is good for our mental as well as our physical health, right?
Heck yeah. I don't think we're meant to sit around all day, so
No.
yeah, it's good to get up and do something fun.
And Dr. Eric Stroemer is with us from Summit Orthopedics. They are moving July the 10th, you said.
Correct. July the 10th, and I have our address and I have our direct line. I would say the one thing since we've merged with the big group is they have a big call center right somewhere in the metro area, and our front desk receptionist Jeanette has been with us for so long that everybody just knows her. They know her, they call her Jeanette, and she knows who, what. So now some of our Faribault patients are a little frustrated having to go through a call center, but we got a direct line back, so people can call us and say, we'll take care of them.
What's the direct line?
So the direct line is 651-968-5150. And maybe we'll put that out on our website too.
Yes.
But again, we're moving off on 21. There's a lot of construction going on over there. They're putting up a new funeral home right out there, and then also
Dr.
I think
Ritchie's putting up a nursing
senior
home.
a nursing home, and Dr. Ritchie has an awesome building there too, but they didn't have any open office space anymore because it was all filled up. So so we're in this building right there on 1645 Lindale. But I like to tell directions by points of interest, so I'm telling people it's in between the Faribault Garden Center and Matt's garage.
Mike's garage?
Mike's garage, sorry.
No,
Sorry,
okay.
Mike.
No, that's okay. So what was that phone number again? I didn't get it written down.
Yeah, okay.
651, I got that.
Correct,
one.
it's 651-968-5150.
651-968-5150, and you dial that number and you get Janet.
Jeanette, yeah. And she'll take care of you because she knows what we all see, what we don't see, and she'll make sure you get to the right place.
Well, that's cool.
Yeah.
And that's Summit Orthopedics, moving as of July 10th to that new location just off Highway 21 instead of up at their location across from the hospital campus.
Correct.
But rehab stays there.
Yeah, right now rehab's staying there until we can figure out if we're going to build a new facility, if we're going to find somewhere else in town. There's not a lot of medical ready buildings in Faribault, so we're going to have to. We didn't have time to figure that out. We weren't notified we were moving until January 1st, so wasn't enough time to build a new facility. So we're we had to scramble a little bit.
Just one of the things you got to deal with.
Yeah, that's how things go sometimes. But but we're excited to stay here in Faribault and take care of the Faribault people, and we've been here for 30 years, ever since Dr. Laney started, and we feel like we have a good relationship with the people in town here, and try to do what's right for them, and be as conservative as possible, and be mindful of insurances and deductibles and all that kind of stuff for people. So.
Dr. Laney worked on my clavicle that I've broken 8 different places.
Yeah, I think, was it a car accident?
Mm-hmm.
I think I remember you telling me that. Yeah.
A couple blocks from the station here.
Yeah.
Back in 1989, 88, can't remember one of those years.
Yeah.
I was just getting ready to go on a vacation.
Oh man.
Yep.
Well, the good thing is, bones heal pretty reliably, and you know, we help them along if we have to help line them up. But
definitely have arthritis in there now, though.
Yeah. Well,
One of the
there's things we can do to help that too, but it's arthritis. Unless you're one of the lucky few, every decade most people start getting a little bit of it, no matter what they did. So
one of those joys of aging.
yeah, it's the golden years.
But they call them.
Right. Yeah, I don't know who named it. Right? They must. I don't think they were in their golden years when they.
Yeah.
Well, I got a new saying someone taught me was, "This getting older is not for wimps." Because yeah, I mean, every decade people are coming in, things are starting to ache more. So
people are living longer.
That's true too. That's another thing I like to remind people, that even 100 years ago, most males were not alive after 65, and now with a little blood pressure medicine and a little aspirin, keep your heart healthy. People are all living till their 80s and 90s now. So we want to keep people moving.
That's the other key in your practice. You keep people moving, which is good for your heart and your whole body.
Yeah, for sure. I mean, I think you said mental health and physical health. Just doing a little bit of getting the blood pumping, getting the joints moving, super helpful. I mean, some of the programs, just the silver sneakers and all these kind of things around town here to just keep people moving a little bit, I think it's going to be super helpful.
Another specialty I saw on the website for you was trigger finger.
Yeah.
What's that?
Well, so that has nothing to do with a gun at all. You never have to shoot a gun in your life to get one. That is where a tendon gets stuck in a small little tunnel in your hand. It always happens in the part of your hand where the calluses are. I don't know how.
Oh, sure, I know what you're saying. Yep.
It's technically.
But it can be to any finger?
Any finger, including your thumb. And the tendon runs through various tunnels to stay in line to go to its particular finger. Well, the tendon gets a swelling on it, and then it just repeats itself going in and out of the tunnel. Eventually it gets swollen enough that it'll lock, where you'll have to physically unlock your finger. You'll feel the lock, and you have to. So that's something, again, that certain little finger brace when you sleep, sometimes some injections, things like that can alleviate it, make it go away. A lot of times, though, we have to do what's called a trigger finger release, which is a small little procedure that, again, we release the roof of that tunnel, allows the tendon to glide freely, and then it goes away for good.
These bodies of ours are amazing, aren't they?
Yeah. I mean, we're just trying to help the human body do its thing is really all we're doing.
I mean, when you talk about the tendons going to certain, I mean, just the whole design.
It's pretty amazing. Yeah, it's pretty amazing. That's, talking about carpal tunnel or trigger finger. A lot of times patients are awake. We just numb the area, and if
they can watch the whole thing.
Well, they don't watch the whole thing in case they cough or sneeze. We don't want that. But when we get everything kind of open, if the patient wants to, we'll let them look inside their hand and see the tendon and the nerve. And most people who want to look find it pretty fascinating. I think it's pretty cool.
Well, of course. You wouldn't be doing what you do.
Yeah.
I think it was pretty cool.
Right, yeah.
So do you do such things as partial knee replacements?
Yep. That's something that works well in just a certain set of people where just one part of their knee is worn out and the rest of it is really good still. So those only work good in people where one part of your knee is worn out where the other two, the cartilage still looks really healthy. The problem is if you put it in someone who has some arthritis in the other parts of their knee, the rest of the knee most likely will wear out in the next 2 to 5 years, then you end up having a second operation.
So you might as well just do the whole thing.
Yeah, so that's where you got to try to parse things out and really get to know the person and their symptoms and where the pain's coming from. And but they can be a really nice solution for some people that really keep them going. And I think in the right people, definitely they're a great solution. But again, once in a while someone will get one and they won't the rest of their knee wear out 2 years later, and then you're having a discussion again, which is unfortunate.
I promised a friend of mine I'd bring this up. Warming up. Before you exercise, you should warm up, right? How long should I warm up?
Well, everybody's a little different. I would say that you want to get your heart rate up into a target range. You want to be breathing a little hard, and almost when you warm up, you almost want to be just starting to sweat a tiny bit. I mean, you don't, warm up's not really going to be part of your exercise routine, but to warm up your muscles, you want to get your heart rate going, you want to get your muscles ready, and you really want to almost be starting to sweat a little bit during your warm up.
So when I jump on my bike, I should warm up before I jump on my bike. I shouldn't just jump on my bike.
If you're talking you mean like you're going to ride your bike around
take a
trails
bike
and
ride.
stuff?
No.
Yeah, I mean, I think, with a bike ride, you can almost use the first mile kind of as your warm up.
Right.
If you were going to, go play volleyball down at the volleyball league, and you're going to be doing all sorts of different motions, there I can see it'd be really beneficial to get all your muscles warmed up a little bit.
Just don't jump on the bike and go full bore right out of the
You might end up straining something, and then you end up in the doctor's office or something. So yeah, I mean, the whole point is enough people get injured or wore out that we don't need people to do it to themselves.
Is majority of the injuries you see work related, or you get a lot of the weekend warrior sports injuries?
It's everything. We definitely see a lot of work injuries, especially around here, a lot of factories, so a lot of people are wearing out or things like that.
They're on their feet all day. And
on their feet, and they're on machines and things like that. But definitely, everybody likes their softball and their volleyball and their golf and bowling, tennis. Yeah, so we see a lot of that weekend warrior stuff. We see high school kids that tear their ligaments playing stuff. So
when I played a lot of tennis, of course I don't anymore, but when I did play a lot of tennis, I had what they call tennis elbow.
Yeah.
I used to have to wear a.
Yeah, so that's a inflammation of some tendons on the outside part of your elbow. It actually turns out it's not inflammation. It's
pretty painful.
Yeah, the tendon is actually getting a little degenerative, and so there's some new solutions for that. Besides cortisone injections, which have been around forever, to help it, and it's very helpful. We now can take a little sample of your blood and spin it down and get your platelets and shoot those platelets back into the area. It tries to help heal it. So,
isn't that amazing?
Yeah, there's some pretty neat stuff for that.
Thanks, Doc, for coming in today. I always enjoy visiting with you.
Hey, wow, that went fast.
Always get educated. So again, July 10th is that date. That concludes today's edition of AM Minnesota. You're in tune to KDHL AM in Faribault, Minnesota.